Orlandi, I'm going to ask you a couple questions. So one of the earliest red flags for COVID at the beginning of the pandemic was patients were losing their sense of taste and smell. We are hearing now that for some of these patients, their sense of taste and smell isn't returning. There's also, and I'm not going to say the name, I'm going to have you say the name of the condition. You and I worked on a blog together last week. Is it pharosomnia? I'm going to let you say.
Phantasmia?
Yeah, okay. It's a condition where people's sense of taste and smell returns. However, it's distorted and normal smells smell really terrible to people. So do you want to comment a little bit on those symptoms that we're seeing in patients, and how long are these symptoms going to last? Will they ever clear up?
Thanks, Kathy. Yeah, just so let me be clear, I misspoke. Phantasmia is when you smell something that's not there. Parosmia is when you smell, you sniff roses, but they smell like rotting, food or something like that. And so that's something we also see. Yeah, the changes to the sense of smell were noted by my European colleagues in ENT pretty early on in kind of February, March of 2020. And it is a very early sign of when people begin to lose their sense of smell. It can precede some of the other symptoms that a patient might have with COVID. So it's one of those things we want to be really aware of. The virus does appear to attack directly the sense of smell, the nerves that conduct the sense of smell that are in the nose. And the problem with that is when those nerves are affected, they can die out and then regrow. And it's a little bit like pulling all of the wires out of a switchboard and trying to put them all back in. Sometimes those connections don't end up where they were originally. And so that's where roses can smell like rotting food, or gasoline can smell like lavender. It's just because the connections are all messed up. We do see sense of smell issues in a large number of people, as Dr. Brown said. 80% of people that have COVID tend to report this. And it does appear to last a long time in a small number of people. It can be permanent, or at least up to a year, as permanent as anything we know about COVID right now, in a small percentage of people. So many will recover, many will have full recovery, some will have partial recovery, but there's a significant number, anywhere from 5 to 10%, that can have a permanent loss of their sense of smell. Let me make one other comment. I keep talking about sense of smell, but as we've talked about, it's really sense of smell and taste. Much of what we perceive as taste is actually smell. And I won't go into all the anatomy, but we remember from kindergarten, sweet, salty, bitter, and so forth are on our tongue. But most of the herbs, the aromas, what you get out of a glass of wine is obviously much more than that, or eating a steak or whatever. And much of that is actually sense of smell. We perceive it as taste, but it's really smell. And so when we have a loss of sense of smell, we do lose our sense of taste quite a bit as well.
And we should point out, this sounds minor compared to maybe heart issues, which we're going to talk to Dr. Shaw about in a minute, but losing your sense of smell, it can be dangerous. Like you smell smoke, that's an alert, to get up and get out of your house or whatever. Yeah.
Yeah, no, you're right. And sense of smell, it's a, believe me, if you don't have it, you miss it. And it's a tremendous quality of life issue. But to your point, the ability to smell smoke, to smell natural gas, to smell rotting food, to smell any sort of other things going on is a safety issue as well. So we do have to work with patients when they lose their sense of smell permanently to factor those things into their lifestyle.
And I have heard it can lead to depression and things like that. And very quickly, Dr. Orlandi, we're hearing a lot about the smell therapy. So can you tell us a little bit about that? And do we think it's helping people?
Yes, so we call this smell retraining therapy. So we've been seeing patients with loss of sense of smell from head trauma, from other viral illnesses. This has been something that we've seen for quite some time, and a fair amount of work's been done. And the idea is you literally retrain your body and your sense of smell. So smelling something like 5 different things: coffee, peanut butter, essential oils like lavender or something like that, and just doing it every day, once or twice a day, can help actually regain some of the sense of smell.